More tonight on a new state dashboard to track cases of cyclosporiasis.
The State Department of Health and Human Services launched the dashboard as cases of that illness climb across North Carolina. Health officials are tracking more than 700 cases of cyclosporiasis since May 1st. WECT's Rachel Holly met with state health officials today about the launch of this new dashboard.
While the outbreak isn't having a major impact here, the state believes the new dashboard will help investigators track down the source of the illness.
The North Carolina Department of Health and Human Services launched a statewide dashboard concerning cases of cyclosporiasis, an illness caused by the parasite Cyclospora. Cases in North Carolina are on the rise, with a total of 718 since May 1st. 157 of those just in the last week. In New Hanover County, there are 7 confirmed cases. Brunswick and Pender counties have 2 each, while Columbus and Bladen counties have none so far. Wake County has by far the most in the state, with more than 400. While there's no confirmed source for the outbreak here, the state notes individuals who got sick commonly reported eating parsley or cilantro.
The most important things to know are that any produce can theoretically be affected. Of course, lettuce and the other leafy greens are the most common culprits, we think, but this is rapidly evolving. And as I said, cases lag behind. So we're still learning on a day by day and week by week basis.
Preventative measures include washing and rinsing fresh produce, although officials say that does not guarantee the parasite is entirely removed. Cooking ingredients to 165 degrees Fahrenheit will kill the parasite. And symptoms usually begin about 1 week after exposure, with persistent diarrhea being the primary sign. Health officials say the key difference from other gut infections is the duration of symptoms.
If it's lasting into days or even weeks, then that's more likely to be cyclosporin.
NCDHHS continues to coordinate with local and federal partners to discover the origin of the spike in illness.
If you believe you may have cyclosporiasis, health departments urge you to contact your healthcare provider to get an antibiotic test and treatment plan. Rachel Holly, WECT News.